Good afternoon and welcome. Bonjour à tous et toutes, bienvenue. My name is Michelle Moor. I'm the Vice President for Vancouver Acute Services with Vancouver Coastal Health. And I'm very delighted to be able to welcome all the guests here today to Vancouver General Hospital. Before we get started, I want to acknowledge that we're hosting this event today on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I also want to mention that Vancouver Coastal Health provides care to 14 First Nations communities on the territories of 14 First Nation communities. For that, we are very grateful, and I'll just invite you to reflect on the importance of these lands. Today, we're going to hear from the Honorable Jean-Yves Duclos, Minister of Health for the Government of Canada, and the Honorable Adrian, Minister of Health for British Columbia. Following the speaker remarks, we'll open the floor to media for a question and answer period. In the interest of time, we kindly ask that you focus your questions on the topic of today's event. It is now my pleasure to invite our first speaker. Over to you, Minister Duclos.
Hello, everyone. Bonjour tout le monde. As you can tell, it's obviously a pleasure to be here once again in Vancouver, and this time at Vancouver General Hospital. Thank you, Michelle, for your kind and warm introduction and your important work and that of your team as the Vice President for Vancouver Acute Services. Parm Barnes, Parm, you're the Member of Parliament for Stevenston, Richmond East, but most importantly, you're a very strong advocate for your community in Ottawa, where I see you and hear you and follow you and cannot evade your attention when you want to speak about health and healthcare, but also obviously in this wonderful community. We're also joined today, as you know, by the Honorable Adrian, British Columbia's Minister of Health. Cher Adrian, comme tu comprends très bien le français, je vais le dire dans ma langue maternelle. Je te remercie et remercie ton gouvernement pour ta contribution exceptionnelle et continue au cours de la dernière année et demie, depuis que je suis devenu ministre de la Santé, en vue d'obtenir ensemble des résultats concrets pour les travailleurs de la santé, les patients et tous les Britanno-Colombiens. George Eamon, as Minister of Environment and Climate Change, you will know that you have a direct impact as well on human health. Your partnership and leadership with my colleague, Minister Guilbeault, and our colleagues in the federal government has been celebrated and remarked. Here in British Columbia, we are often ahead of other regions in Canada when it comes to protecting the health of the environment and the health of our citizens. I'd also like to thank warmly the Vancouver General Hospital for hosting us today. And I particularly want to recognize the staff and healthcare workers of Vancouver Coastal Health. We know that you have suffered greatly during the pandemic, but you are working and keeping working very hard, delivering exceptional care in exceptional circumstances to ensure that the people here in Vancouver and throughout British Columbia get the health care they need and deserve. You have taken good care of us, and we all want to take good care of you too. We're here to support you as you carry out that important work. Last month, the Government of Canada released the 2023 federal budget. It builds on our plan to grow Canada's middle class, to make life more affordable for Canadians, and to build a green and solid economy that works for everyone. Budget 2023 also includes investments in healthcare, initially announced by the Prime Minister on February the 7th. That plan, the Working Together plan, includes nearly $200 billion in additional investments to improve healthcare across the country, because a strong healthcare system is essential for a strong and healthy Canada. As part of this collaborative plan, British Columbia will receive more than $28 billion over 10 years to address a range of needs in shared priority areas, such as expanding access to family health teams, supporting health workers and thereby reducing backlogs, increasing mental health and substance use support, especially for younger Canadians, and because data saves lives, working together to modernize our health system. Indeed, better access to health information and health data not only empowers patients, but it also helps health workers make more informed choices and provide higher quality of care. And if I may open a brief parenthesis, what Adrian, George, Parm, and others saw just a moment ago when we visited the modern facilities here demonstrate very, very clearly the value of sharing data, enabling teamwork in order to provide better, saving, and safer care, and in many cases, saving lives. Now, this being said, helping Canadians age with dignity, close to home, with access to home care or care in a safe long-term care facility is another shared priority where collaborative work is already underway. Some of that work began in 2017 when the Government of Canada committed $11 billion over 10 years to provinces and territories to improve access to home and community care and to mental health and addiction services. Les premières ententes bilatérales ont permis aux provinces et aux territoires de recevoir la première tranche de 5 milliards de dollars. Grâce à ces ententes, les provinces et les territoires ont mis en place de nouvelles initiatives ou ont élargi des initiatives existantes afin d'améliorer les services offerts aux Canadiennes et aux Canadiens. Nous annonçons aujourd'hui la poursuite de ce travail collaboratif pour mettre en œuvre de nouvelles ententes d'une durée d'1 an. Today, I'm announcing with Minister Dix that our governments have signed a 1-year agreement to continue increasing access to home and community care, as well as to mental health and addiction services. Through this agreement, British Columbia is receiving close to $164 million for 1 year. The government of British Columbia will be able to build on the progress made in the first 5 years and use the funding to continue to address these priorities, including for respite services, community-based caregivers, and palliative care services. That's important because our population is aging. According to the 2021 census, there are now more than 1 million seniors in British Columbia, making up 20% of the province's population. Their health needs and health care needs are growing and diverse at the same time. Many seniors want to remain in their homes for as long as possible, but lack support to do so. There is also a growing need to provide Canadians, and especially younger Canadians, with access to timely and integrated mental health, substance use, and addiction services to support their well-being. I will let Minister Dix, Adrian, provide more information on how his government intends to use the funding to improve access to home and community care, as well as mental health and addiction services. En terminant, comme nous le savons tous, les 2 dernières années et demie ont été très difficiles. La pandémie de la COVID-19 a révélé et aggravé de nombreuses lacunes dans nos systèmes de santé et de services sociaux. Ce sont des lacunes que nous devons combler ensemble et je remercie à nouveau Adrian de sa superbe collaboration et même de son leadership au sein des ministres de la Santé du pays au cours de la dernière année et demie. Today's agreement is another proof that working together is really our best and only interest for patients, for seniors, for health workers, and our healthcare system in general. Having said that, I would now warmly welcome Adrian Dix, Minister of Health in British Columbia. Merci. Thank you.
Thank you, everyone. It is great to be here today. It was a real privilege for Minister Duclos and myself to meet with doctors and nurses and healthcare workers on this site and the brilliant work that they do on this site, supporting patients every single day. It is a moving and exceptional thing. We've been through a period when we haven't done this as much. We haven't seen each other in person. We haven't done events from this spot very much because we didn't want to obviously disrupt our public hospitals in the way that that can happen during the early stages of the COVID-19 pandemic. But what's clear, and today Minister Duclos and I visited operating rooms and surgery here at Vancouver General Hospital. Yesterday he was in Victoria doing some of the same work. And what has happened here in the last number of years is truly exceptional and worthy of celebration, not of governments, not of Minister Duclos' government or of mine, but of our healthcare workers, our operating surgical nurses, our surgeons, our anesthesiologists, our medical device processing technicians who have done brilliant work. Only in British Columbia and in PEI did we see an increase in surgeries during the years of COVID, only in these places. Only in British Columbia have we seen a reduction in wait times for surgery, a major challenge for things, because if you are waiting for surgery, you are waiting for something that will be transformative in your life, whether it is an emergency surgery, which requires immediate attention, or what we sometimes call elective surgery, but is also urgent and medically necessary surgery as well. And what's happened here, and this has been a joint effort with my colleague, Minister Duclos, is an effort to improve and reform the way we do surgery, to invest in its capacity, 100 measures to increase surgical output in the province. That means more people getting surgeries on time. And that's our combined effort. And these 100 measures have been in a public healthcare system under a Canada Health Act and a Medicare Protection Act that we support as governments, but we have to give life to by providing care for people. It's not simply important to win in court, although we did that last week, if you don't deliver the service. And what we're doing here at Vancouver General Hospital is delivering the service. Today, I have the honor to speak to our agreement around home and community care, mental health, and addiction services. In 2017 and 18, we signed an agreement together to make improvements. And just to give you a sense of what that is, because I think it's important to understand what that means, the agreements and their statements, and I could read them out here, the nature of the agreements, in-home respite supports. What they mean is care for people where they need it. We have, as Minister Duclos has said, an aging population of people over 75. We expect twice as many people over 75 in BC in the next 10 years. And we need to provide, of course, that has implications for surgical care, age-related cancer, all elements of care. But we know, and anybody who knows anyone who's getting older and knows that people want to live at home as long as possible. And so home and community care is about improving and increasing home support. And we've done that under this agreement. And we've done it in the year of the agreement we're announcing today, the $164 million. And we will do it in future years because of our partnership and our commitment. When the federal government talks to us about what they want to see, they want to see supports to people closer to home. And when we talk to the federal government, we tell them what we want to see, supports for people closer to home. And that's what this agreement has built. In terms of professional services, community-based professional services, those increased in this period since I've been Minister of Health by 28% in BC. Those are professional services largely delivered to people in their home. And we did this because of the contribution of the provincial government and also the shared partnership and the priority that the federal government, meaning Jean-Yves and Parm and their colleagues, and the whole federal government to home care and home support. And finally, I wanted to note, because we're living in a period of pandemic and a period of public health emergency that was dramatically exacerbated pandemic, which is the overdose public health emergency in BC. I can tell you that we've significantly increased community beds for people who need mental health services. This is an absolute priority for our government. And I think it demonstrates the success and also the challenge, the fundamental challenge that we see every day. We see it here in Vancouver, we see it in Prince George and everywhere, of delivering a mental health and addiction system that is equivalent of the system that we provide when people struggle with physical illness. That challenge is a focus of this agreement as well. I want to note that we've opened 316 new mental health and addictions beds since this agreement was signed with the federal government. Not all of them the result of this agreement, but supported by this agreement. A lot of it is our commitment. That in our most recent budget, we've dedicated dramatic new expenditures for complex care housing. And we've announced services for 427 complex care clients in communities across the province, providing that care closer to home, providing that care in community, providing that care that says that treatment in a process that can be a lifetime process is something that is a priority for all our governments. And so this agreement that comes from 2018 that was extended, what we're announcing today for 22-23, and is being extended through our very significant agreement around the Canada Health Transfer and its bilateral agreements in the future, demonstrates our joint commitment to these issues. We have to provide people care where and when they need it, whether it's cardiac surgery, as we've seen some examples of today, or support for people struggling with addiction. And what we're doing today and the work that we're continuing to do avec le ministre Duclos, qui est un partisan important de la santé publique au Canada, our work together will continue in this time. I'm very proud of the work we've done together to build new agreements, the work we're doing together today and tomorrow on issues from Indigenous health to long-term care to other parts of the healthcare system. But this agreement that we're talking about today is an agreement that demonstrates that commitment and who we're focused on, which is people living in community, needing care in their communities closer to home so they can live their lives, whatever their circumstances, their health circumstances, to the fullest possible extent. Merci beaucoup, and we're happy to take your questions, I think. But we're gonna, back to you.
Thank you so much. Thank you, Mr. Duclos and Mr. Dix. It's been an honor hosting you here at Vancouver General Hospital today and sharing with you just a little piece of the amazing care that happens in this province. That concludes the formal speaking portion of today's event, and I will now invite Guillaume Bertrand to open the media question and answer period. Guillaume?
Thank you. Thank you. We will first take the question on the floor. There's a mic on the left of the room. Before moving to the question online, on va prendre les questions ici sur place avant de bouger sur les questions sur Zoom. Please limit yourself to one question, one follow-up. No one. Looks like we don't have any question here on the floor. So Mark, I'll pass it over to you online.
Thank you. If you are a journalist on the Zoom and wish to ask a question, please use the hand raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Our first question comes from Justine Hunter with the Globe and Mail. Justine, please go ahead.
Hi, thank you. I know you wanted us to be on topic, but I want to ask about Ozempic, and I'm wondering if Mr. Duclos, are you taking any action to tackle cross-border shopping for prescription drugs when there are potential shortages?
Yeah. What I might do, Justine, is go first. We had some discussion on this today, and then Minister Duclos can speak. Will speak afterwards. In the last number of weeks since we raised this issue, significant action has taken place. Obviously, a review by the BC College of Pharmacists. This is ongoing, information shared with the College of Physicians and Surgeons in Nova Scotia, the suspension of the license of a physician. And I think the demonstration, I think the scheme being proposed, where a doctor licensed in a Canadian province but living in Odessa, Texas, can make 17,000 prescriptions in 3 months, doesn't make any sense. Until we're taking action on that in British Columbia, and we've worked with other jurisdictions to deal with it. In addition to that, our officials, Minister Duclos and mine, have already met, and ADMs from across Canada have already met on these questions broadly. I think he has demonstrated right from the beginning his support for the actions we're taking, and is obviously working with us now to look together for permanent solutions. And I think I'm been impressed by how quickly we've worked together on this. The action taken by Nova Scotia, I want to say the actions of the Nova Scotia government, the Nova Scotia College have been excellent. And we have to take the step, because when we have a drug in Canada so important for people with type 2 diabetes, such as Ozempic, we have to make sure it's available for Canadians. And Minister Duclos has made it clear that he is going to both support our efforts and work with us to provide a permanent solution to these issues. It is not just Ozempic, as you know, within this class of drugs for type 2 diabetes, whether it's semaglutide or other drugs that will be available in this class. This won't be the last time we see this issue, given the promotion around this particular class of drugs for weight loss. So I'm pleased with the actions taken. I think the meeting, our first meeting involving other levels of government occurred last week. And we're going to continue to do this work together. And I want to hand it over to Mr. Duclos.
Thank you very much. And I'll start by underlining Minister Dick's leadership in that particular case. I want to do that because, as he mentioned, not only is this drug an essential drug for British Columbians, but it's also part of other challenges that we're going to see in the future. And those challenges come in part from the fact that our society is changing. The delivery of healthcare is also changing. There will be more virtual care provided in the next years for all sorts of good reasons. There will be more jurisdictional collaboration across provinces and territories as we prepare for the future of our healthcare system. This being said, it has to be essential that Canadians, including British Columbians, have access to all essential drugs. And that's why, in addition to supporting and highlighting Minister Dick's work with other provinces, in this case, in particular, Nova Scotia, I'll be there to support all of the other important work that needs to be done across provinces and territories, recognizing, yes, that the practice of medicine, the practice of pharmacy is of provincial jurisdiction, but also recognizing that the federal government has a responsibility to work with all provinces and territories, and they make sure that Canadians, wherever they live, have access to these essential drugs. So again, I congratulate and support Minister Dick's work. There might be an opportunity to use the Food and Drugs Act in circumstances where bulk exportations are made of essential drugs to other countries. If and when that is needed, that will certainly be considered, but certainly we'll be supporting again Minister Dick and all other health ministers in Canada, making sure that this increased and beneficial use of technology and collaboration across jurisdictions never comes at the expense of drug access.
Any follow-up, Justine?
Yes, please. Thank you. So we know that thousands of prescriptions for Ozempic were being sent down to the US just in the last couple of months. Do you believe there's any legal loopholes here that are being exploited that a federal government or a national effort would be required to close?
Why don't I go first again, and then I'll have Minister Duclos will follow up. I think possibly is the answer to that question. And so that's something we're going to work on, because having a national solution makes sense. Minister Duclos is correct. Part of this jurisdiction, and this for broader distribution, there's already federal rules in place that say you can't do this in the case of shortages for distributors. That's under federal jurisdiction. And when pharmacists are acting as pharmacists, they're acting in provincial jurisdiction. But in this case, they're sending prescription drugs that may be in limited supply, and drug shortages, Canada has indicated there may be some limited supply of some types of Ozempic, that people in pharmacies sending it across the border to the United States doesn't really make sense. So what we're going to work on together is the best possible solution together. And Minister Duclos has indicated that he's absolutely prepared to do that. And there may be mechanisms under the Food and Drug Act that might be good ways to address that across the board, as they have for distributors. Some people have asked us about this question in the context of the American healthcare system. American healthcare system, as you know, has generally more expensive prices for prescription drugs than ours. And we should understand what the reason for that is. It's largely because we have public health care in Canada. And my recommendation for people wanting to change that in the United States is to make change in the way they do business. You know, they passed prescription drug acts in the past that don't allow the American Medicare program to reduce costs of prescription drugs and to negotiate on the price of prescription drugs. Well, that doesn't make sense, but we can't support that system by using what can be limited supplies of our drugs. And I don't think manufacturers and pharmaceutical companies are going to allow us to do that in any case. So what's been shown in this case is an example of what can happen. We're taking action. The federal government is working with us for long-term solutions, and I'm very pleased at the response we received from Minister Duclos today, and since this started, from federal officials.
And again, on A, monitoring, and B, enforcing. So monitoring is key in those situations, and we have a strong Health Canada team that monitors shortages in key essential drugs, and I expect them to keep doing that job, supported by the informed evidence that provinces and territories like British Columbia also have. This is in the case of this particular drug, it's been localized. Well, Nova Scotia physician who actually lives in the United States, and then prescribing thousands and tens of thousands of a drug that would then be delivered by a couple of pharmacies in British Columbia. So we were able, because of the leadership I mentioned earlier, to rapidly point to where the issues arose. However, if, as Minister Dick said, those issues happen to be different, more generalized, leading to clear shortages for patients across Canada, we would have, under the Food and Drugs Act, an ability to prevent, to forbid the bulk exports by manufacturers and distributors of essential drugs outside of Canada.
Merci, le ministre. Next question comes from Camille Baines of the Canadian Press. Camille, please go ahead.
Hi there. Can you just talk about how this person was able to prescribe to thousands of people? I mean, you can monitor shortages, but can you not monitor prescriptions as this person is carrying on, and then this whole thing comes to light?
Well, the short answer is we did. But remember, there was 2 jurisdictions involved. So this individual prescribed, I gather, from 17,000 prescriptions in 3 months for Ozempic. And then those were distributed. And we want doctors from across Canada to be able to provide prescriptions and have them accepted across Canada. We want that, right? And so I would say that in a general sense, but what happened there is that we identified this issue. You recall, Camille, when I announced access for Ozempic as a second-level type 2 diabetes drug in January, I raised this issue and said we'd be monitoring it. And we did monitor it, and we in our analysis, because we have a very in-depth knowledge through the PharmaNet system of the prescribing patterns in British Columbia, we saw this and we took action. And within a short period of time, the Nova Scotia College, yes, they can take action, and they did. We brought the evidence to their attention, and within, it might have been hours, certainly a couple of days, the Nova Scotia College took action against this physician. And I think I'm very appreciative of Nova Scotia and their work here. So we took action immediately as we determined the problem. We announced what we intended to do. We got the evidence, we talked to Nova Scotia, and they took action. All of that happened within a few days. And that's a sign, I think, of Canada working well together. So no BC licensed doctor is engaged in this. And when I talk to doctors about it, they are not supportive of this kind of scheme.
And how, maybe Minister Duclos could answer this, how could you prevent this kind of prescribing in the future, whether it's by a Canadian doctor or an American doctor who's licensed to practice in Canada in all provinces? BC might have acted, but what about other provinces that might not be on the ball as much?
We don't want to prevent use. We want to prevent abuse. we don't want to prevent use because it's normal in the Federation that Canadians would sometimes need to travel, have their family doctor live in one province and themselves travel or live in a different province. We want that type of collaboration across a federation. Canada is stronger because of being a federation. So we want that to happen. We also want Canadians who happen to travel to other countries and to the US in particular, if they need a drug to be delivered to them, not being physically in Canada, we want them to have access to their drugs, even though they may be in the United States for a while. So we don't want to prevent use, but we want to prevent abuse. And Minister Dix has pointed to a level of abuse that was outrageous. He pointed to the fact that he and his government and his team worked quickly with Nova Scotia, which then, as he mentioned, also acted quickly. We were there to support and will continue to be there to support Minister Dix and any other health ministers in these important circumstances.
Merci beaucoup. Prochaine question. Next question is from Wolfgang Deppner with Black Press Media. Wolfgang, over to you.
Yeah, thank you for taking my questions, ministers. Good afternoon, first of all. A question to Minister Dix. The Human Rights Commissioner just today released a statement regarding the ending of mask mandates in healthcare settings. My question is as follows. What, if any chance, have you had to review her statements yet? And what is your reaction to it?
Well, the answer to the first is no. And so my reaction to the statement is it's hard, it's impossible to react to something I haven't seen. But here's what I would say. British Columbia took some of the strongest and most imaginative action. I'll just wait for that. In dealing with the COVID-19 pandemic across the board. So with respect to a mask use, 100% of healthcare workers in our public healthcare system are now vaccinated. We have a vaccine mandate. We were the only jurisdiction in Canada to do this. And this action, which continues and which will continue, is an action that supports, because it provides protections in our healthcare system, other actions that we take. In this period, provincial health and our provincial health officer has determined it's going to make changes as we've repeatedly taken to adapt to the changing nature of the pandemic. And that's precisely what she's done in this case. There are those on vaccine requirements and proof of vaccination requirements and on masks who think we should take different actions on both sides of the issue. But our actions in BC are governed by public health, by a provincial health officer who is committed and determined to both support people, but also to take measures only when appropriate. And that's the decision she's taken in this case. And I think Dr. Henry and her teams have demonstrated both their extraordinary commitment to people and his value over time. 3 years ago, we took actions that were unprecedented in Canada and in British Columbia. And I just remind people how remarkable people responded to that in our province, the things that we asked people to do in this setting, and we talked about it today. For a time, we had to, as you know, we had to delay non-urgent scheduled surgery in our province. It profoundly affected everybody who works in this place and people who come here. And how we responded was a surgical renewal commitment that has allowed us to, in fact, do 99% of those delayed surgeries, 99%. And actions that were done by healthcare workers here to adjust procedures in order to allow that to happen. This is an exceptional thing. And we've taken those actions over time, and we're going to continue to. Dr. Henry's decision, as always, was based on the evidence last week. She made adjustments that other jurisdictions have made, but we are continuing to recognize that we live in a pandemic in British Columbia and take other actions that, including the vaccine requirements that are unique in North America. But I'll read the statement and let you know,
Yeah.
Wolf.
Yeah, okay. I'm happy. I'm actually happy to share the statement. Just for the record, the statement reads in part: this week's removal of masking directives in healthcare settings does not uphold a human rights-centered approach to public health. That's what the statement says in part.
Well, I think that I just say that I disagree with that. I think if what the Human Rights Commissioner is saying is that we shouldn't have, like her, an independent provincial health officer making important decisions under provincial health orders, independent but supported by government. If that's the view, then I don't share that view. I think that Dr. Henry has been an exceptional leader in this pandemic. Our teams in Vancouver Coastal Health, where I am, where Mr. Heyman and Mr. Duclos, Mr. Baines are today, have done an exceptional job. That's our public health lead public health officer, Dr. Patricia Daly. I think they've done an exceptional job. And you know, we've been criticized at various times in this pandemic. But some of the things I'm most proud of are some of the things we were most criticized for. Keeping schools open in BC, because we understood the health effects of closing schools and having children get an education in BC. That's something we did in BC to an extent that nobody else did. And that was the commitment of our public health teams. The action we took for healthcare workers working here and everywhere else in BC, who were supported in the pandemic when we put a single site order in place by raising salaries, which had been in some cases poverty wages, to the collective agreement level, 165 million annual expenditure in BC. We did that here. Farm workers, when they came to BC from other jurisdictions, were given and supported with quarantines to support them and stop the spread of COVID-19, a unique model that has won British Columbia praise in multiple jurisdictions. And when you look at the outcomes for farm workers, both Canadian and temporary farm workers in our system from COVID-19, you'll see that those actions, those unique actions, were different than other jurisdictions who had much greater difficulty in that regard. So we've consistently taken an action directed by public health and supported with resources from our public healthcare system, and we're going to continue to do so. And that is, all of it is based on the fundamental dignity of people.
Thank you. And the next question is from Mary Brooke with Island Social Trends. Mary, please go ahead.
Thanks. The funding extension for 1 year that you announced today, what sort of data is the federal government looking for to have that extended for multiple years? And will it be in the same areas of home care, mental health support, and the opioid crisis?
Thank you. And indeed, it's extended for 1 year. And we're now looking forward to extending it for 4 additional years. And the great news is that this is going to be done in connection with and in addition to the investment that we're going to make together, flowing from the agreement that we came to with the province on March the 1st, the agreement in principle, which will flow to the province of British Columbia, approximately $3 billion over the next 10 years, just through the bilateral transfers focused on family medicine, mental health care, supporting workers, and investing in data and in technology, as we're doing here at the Vancouver General Hospital. Now, that obviously is important if we have the right data to guide us. Data and guidance are essential to providing appropriate health care. This is the result of modern technologies, but also modern ways for workers to work together in a team context. And again, I want to flag that we are doing this exceptionally well at the Vancouver General Hospital with the leadership of the province, obviously, but certainly, and most importantly, with the leadership and of the health professionals in the hospital. So we're going to look at, and I'll turn to Mr. Dix in a moment, we're going to look at the number of people that have more access to mental health and addiction services, especially for younger Canadians. We know the level of stress and anxiety that Canadians have been feeling because of COVID-19, but because of other things that are happening on our planet. In 2023, it's stressful to see what's happening on Earth, and it's in family circumstances and individual circumstances often put an additional level of anxiety. So to deliver appropriate and timely addictions and mental health services is key, and the province has been strong on monitoring the impact of its investments on those types of indicators. For community and home care, again, Minister Dix alluded to that earlier, the fact that we are able to provide services, direct services at the community or home care level, so that people can age in safety and dignity at home or close to home. So indicators like the number of workers we're able to, and personal service workers, we're able to hire, to retain, to upscale, to provide the best quality possible services to seniors in this province. The number of rooms that have been enhanced, community rooms, safety, protection against infections, inspections of the long-term care homes that are under some standards, some norms for the quality of work and the quality of care. But on that, Minister Dix, I might turn to you.
Yeah, and under all these agreements, we have reporting requirements that we engage in. In the case of these agreements around home and community care and around mental health and addiction services, the commitment of the government of BC is such that it's very easy to meet the test of the agreement. We've seen a significant increase, for example, in home support hours in BC since this agreement came into place. We've seen a dramatic increase in community-based services, 28%, as I said, in those hours, which are community-based public health visits, largely to people's homes. In terms of mental health and addiction, you've seen the dramatic increase in beds and the services provided, the most significant increase in spending, but also in action of any area of healthcare in our province. Those are the subjects of this agreement. And then if you look at long-term care more broadly, which we're looking at in this in the future agreements as well, you've seen us move from having 90% of care homes not meet standards when I became Minister of Health, to everyone meeting standards in terms of the own standards we set for staffing in long-term care. You see that the actions that have been taken under the HCAP program, and Health Human Resources is always a problem, adding more than 7,000 workers to long-term care during this period of pandemic when people of long-term care have struggled significantly. So this has been an area dating back before the pandemic where the federal and the BC governments have made investments. And from my point of view, it was critical that we did at that time and that we continue those. This is a one-year agreement because we were dealing with a lot of, obviously, all the issues around the Canada Health Transfer together and all the agreement issues together. And we look forward to extending it through the 10 years that it was envisioned on when it was originally signed. And then I would suggest beyond that as well.
Regarding aging in place, I'm wondering what your cross-ministry approaches might be. I'm thinking about housing initiatives in some Scandinavian countries where they actually change the complexion of their community structures, their houses and communities, to have places to live for seniors who age in place with young people in the same homes, buildings, streets, who are financially supported through social supports to have a knitted community approach. Is BC looking at this yet?
Absolutely, and it will require much more than just healthcare. In cities such as Vancouver that we live in, we need communities with a growing population of seniors, which are more open to seniors living. And so that requires, as you suggest, Mary, the full spectrum of supports and services, some of which are healthcare in the sense that the Ministry of Health is involved in them. All of them are about people's health. So that means we need to expand long-term care. We need to expand and assisted living. and home care and home support, and that's part of this agreement, and mental health services related to seniors, and dealing with the fact that many people need to live in place and need supports to do that. In addition to that, there's an issue of access to housing, changing the way that we build seniors housing, because typically in our care settings, those have been a few stories, those constructions, and we're going to have to, in a city like Vancouver, in our seniors care, and take a look at what we're doing with Providence Healthcare at St. Vincent's, we're going to have to go up in a number of places and change the way that we do that. You know, this is a commitment that we need to make because our society is changing, but it's also a commitment we have to make in the COVID-19 pandemic. The one thing covered by this agreement, which changed after the COVID-19 pandemic was in place, was our adult day programs, which had received the most significant expansion, and we're going to in the period after 2020. And obviously, after the pandemic was declared, we had to essentially cancel those programs, and they're now building up again. But those programs allowing people to live in community and allowing people in different circumstances where their community of friends, some of their community of friends may have died, the critical aspect of having adult day programs and having engagement for people in communities and support in a time when we don't all live together in families and we don't all live in the same communities as families is increasingly important. And some of it areas about healthcare and some of it is about broader housing questions. Both of them are significant priorities for ourselves and for the federal government.
Merci. No more questions on the Zoom.
We
Guillaume.
have one more question on the floor from pot.tv to you.
Neil Magnuson, pot.tv. In reference to the overdose crisis, the public health emergency that's been raging for the last 7 years, the cannabis substitution program has been demonstrating very successfully that high-dose edibles are very effective in assisting people through withdrawal. They've rescued hundreds of people from addiction. There's a problem with the federal government in not licensing the program and allowing low barrier access. What action will you take in the future to facilitate low barrier access to high-dose cannabis edibles, as it has proven to be very, very effective in helping people get off of those drugs?
Good, and I wish my colleague, Minister Bennett, were here. She would provide a better answer to that important question. She would probably say that it's a program that, as you said, needs to support the safety and the health of people. So these are somewhat related, obviously, but also different. So we need to make sure that the products and the procedures that lead to their use are safe and protect the lives and the health of Canadians. And it's true that Health Canada, and in particular the regulatory branch of Health Canada that deals with drugs and substances, do their work in the most serious but also the most agile manner, being efficient, not only being resistant to change. At the same time, as you also point, there are often and there are health benefits to changing those regulations. We've seen progress over the last few years, regarding cannabis in particular, but other substance uses, including here in British Columbia, as you've seen with the leadership of the province, the city, the police force, the community services, the health experts. So we are making progress, but there is always more progress to make. And again, I would invite, if that's possible and it's useful, I would invite my team to be able to connect you to Minister Bennett. She could provide better and greater details to your question.
It's been 6 years that the program has been operating. They were deemed an essential service during the pandemic. The application to the Special Licensing Exemption Division of Health Canada has been in for over 2.5 years while they stall and delay. And the reason that they say that they will not license the program at this point is because all of the supply is not legal, although we've provided several avenues for that to be the case, and we would like that to be the case as well. And their other one is that they don't want full-grown Canadian adults to get access to high-dose edibles without a doctor on board. And in the downtown east side where we've been operating, 95% of the clients that rely on us, that have gotten off the drugs because of us, do not have a family doctor, could not get one if they wanted one. In many cases are afraid of the healthcare system and couldn't. And we're being asked after 6 years of providing this service to turn our backs on these people. This is really a travesty going on that I think some attention perhaps from your office and Mr. Dix as well. I've sent emails out regularly to the health minister, to many different people. I would love to connect with your team of people and make this happen, because it is very, very important.
And that's correct. So there is the theoretical availability of drugs, but there is then the practical access to the services that enable people to use those drugs and the treatments that go with them. So and you point to access to family medicine. In British Columbia, we're making significant efforts in many different ways to improve access to family health teams, in teams being key, not necessarily family doctors, but other members of a family health team that can be useful when it comes to caring for people. Access is key in all sorts, in all aspects of healthcare, including the one that you mentioned.
Sorry, that's all the time we added for the press conference. We asked for one question and one follow-up. So we've been a bit over time. Thank you. And thank you to the hospital for the warm welcome.
Thank you.
Thank you, everyone.